cigarette smokers had the same low death rates as people who don't smoke cigarettes.
Here, the American Health Foundation Research Laboratory writes the anatomy of a cigarette without the glitter of Madison Avenue rhetoric. The story's a grim one. The glowing tip of a cigarette is an 800-degree centigrade combustion furnace. Cigarette smoke is filled with tar, a mixture of over 300 hydrocarbons. This family of chemicals routinely causes cancer in experimental animals. There's nicotine in smoke, too. It's excellent for killing hearts and battering the linings of vital blood vessels. The average heavy smoker will smoke about 750,000 cigarettes in a lifetime. And he can expect to live about 8 years less than a non-smoker. Reduced to grade school arithmetic, it's about 1 minute of lost life for every minute of smoking. And for those smoking doesn't kill, there's something almost as bad: emphysema.
Emphysema today is growing into epidemic proportions in the United States. And in the vast majority of cases of emphysema, the cause is cigarette smoking.
Shortens my breath, and I do have a little emphysema. Some irritation or something in your lungs, and presumably it's from smoking. I'm trying to cut down. I might get emphysema, I might not.
What is emphysema? It's the rupture and tearing of air sacs. In the normal lung, we have a series of balloons with an elastic fiber around them. These are the air sacs. You can't see these air sacs normally, but when emphysema develops, in other words, when the walls of the air sacs become damaged by the cigarette smoking, the elastic bands are ruptured and larger spaces develop until finally you see these huge air sacs as are present in this individual. You wonder how this man lived.
Like having your breath shut off. You just can't get enough air. Much like smothering. I presume if I'd never smoked a cigarette, this wouldn't bother me a bit, because I've been in no occupational fields that would cause this. 35 years, I'll smoke about a pack of cigarettes a day or better, until just recently.
Emphysema begins innocently, often with nothing more than mild bronchitis or smoker's cough. But the disease is insidious, and each additional cigarette destroys another minute portion of lung tissue until each breath is labored, until each breath becomes a precious gift, until breathing itself stops.
And I would very much like to have a cigarette right now. Well, I'll be 50 years old this summer. But I doubt seriously if I live 10 more years.
Now, it ain't because that I don't smoke myself. I don't reckon they hinder your health. I've smoked them all my life, and I ain't dead yet.
Yeah, enough's enough. You know, you go to the store and you can't buy tuna fish because, you know, tuna fish has mercury poisoning in it. Tobacco, cigarettes, cranberries. You can just go down the line. You end up with an empty shopping bag. It's just horrible. It really is. You know, so if you're going to die, you might as well go out with a full shopping bag. To hell with it.
Smoke, smoke, smoke that cigarette. Puff, 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 and if you smoke yourself to death.
They'll say you're at the Golden Gate that you hate to make it wait, but you just gotta have another cigarette.
Edgar Heiskell, M.D., 52, father of 6, a superb surgeon, a loving husband, a compassionate man, and a smoker who didn't make it, a smoker who died.
At the time of his death, we had been just drinking coffee and talking. And as he sat and talked, all of a sudden he grabbed his chest and bent forward and moaned.
3 or 4 months ago, he said, I've got to cut this smoking out or I won't be here a year. He doesn't have to now.
How would you describe it?
I can't.
Dr. Heisman? Yeah. Yeah, just so we have 2 pints of blood for in the morning at 7:30, because she has cancer of the stomach, and I know we're going to need it. All right, thank you. Yeah, but try to get the other if you can. Okay, bye. I had what I thought was a pretty well controlled smoking habit, in that I enjoyed a cigarette after breakfast and after an operation, and perhaps in the evening after dinner, maybe 3 or 4 cigarettes a day. Then, as I got busier and as I got more involved in the complicated problems, it seems to me that I could sit down with the knowledge of a patient's problem and look at the x-ray with the x-ray specialist, and smoking a cigarette seemed to enable me to cerebrate or think more clearly. So now it's just insidiously increased to such a point where I'm smoking a pack and a half of cigarettes a day. My concern is my own family history, and I accept the allegation that smoking does have a harmful effect on the circulatory system, the coronary arteries and the other arteries. And in my particular case, my father died from a stroke. My grandfather died of a stroke. I had 2 uncles die relatively early in life, that is, one at the age of 52 with a stroke and the other with a heart attack. So this is my concern.
A human lung overrun with a killing cancer. For this laboratory, the lungs keep coming from every state, from young and old, from all social strata. For 18 years, dead lungs have been delivered to this lab for study.
Cigarette smoke causes an increase in the number of cells of the bronchial tubes, and that increase of cells is the preliminary stage to the development of lung cancer, as we spoke of before. And in addition, the glands in the wall are also being stimulated, and these cells are atypical, so that when these individuals cough, they cough as a result of the atypical cells going on to cancer within their walls. So that the cigarette cough is not just an innocuous cough.
Well, I've had a chronic cough for 2 or 3 months, and like most doctors, you try to avoid doctors, and it was kind of strange. Finally, one adamant doctor insisted that I have a chest x-ray. So when I saw the chest x-ray with my friend the radiologist, this may sound strange to you, but when it was all right, I felt like I had a new license then to smoke as much as I wanted to. Completely irrational. I think that this is a drug, nicotine, and it is a stimulant to me, and it is extremely difficult to get rid of it. And this is why I would like to get my wife and myself advised to get off the weed.
Certainly, if you think it's a trivial threat, you're not going to do something that's difficult or unpleasant just to protect yourself against an unimportant threat. Secondly, you have to have a feeling that it has personal relevance, that it means you and not the other guy. And there are people who feel, well, they're not going to get cancer because nobody in their family ever had cancer, or that they don't smoke enough to get cancer. You know, they only smoke 19 cigarettes a day, and you got to smoke at least a pack a day. And then finally, the question of whether or not you think you're capable of giving up smoking. Because if you're convinced that you can't give up smoking, you know, why bother even to try? So you have to have some sense of ability to cope with it.
My wife is a heavier smoker than I. She smokes in the shower, really. Now, you could go in there sometime and look, and there's this blue smoke trailing up over the shower curtain. It's no joke, and it's on a soap dish. She had an episode about 3 years ago which was interpreted as a mild coronary occlusion. It scared us all. Well, she was off cigarettes for about 2 months, and she started back again.
I can see the bathtub, but it's a little tough in the shower. Those soggy cigarettes.
How to stop. Dr. Jerome Schwartz, a behavioral scientist, has studied over 100 techniques for quitting smoking.
Well, I don't really believe that.
He finds no panacea, with the exception of determined commitment.
For example, if you go to a psychiatrist and have hypnosis, it really won't work any better than if you go to Smoke Watches, or if you read a book, or if you figure out your own method and quit on your own. Each method will get maybe 1 out of 5 or 1 out of 4. And if somebody tries one method, it may not work for them. They may try another method. It may not work for them again. They may try a third, and it may work then. So it takes commitment, and it's not really the method.
I used to worry constantly about heart disease and cancer. And now I don't seem to, I guess I think it's too late.
Well, is it too late?
Yeah.
Well, no, it's not. Even with people who have heart conditions, their length of life is almost the same, and practically is the same, as people who, whether they smoke or they don't smoke, as long as they stop at the point of that heart attack. Is that right?
That's correct, absolutely. But I think the very fact that you have given her this information, and this is a failure on my part not to have recognized this lever, that it isn't too late, that there's still much benefit to be derived by stopping smoking.
I mean, I think the health angle is enough for you, but what else would you like to get out of quitting?
Feeling better and less fatigued. And I think this does contribute to fatigue. I think it's an illusion that between operations I get a bang out of smoking, I get a lift out of smoking. This probably will prove to be false.
I think you'd have to pick kind of a joint quitting date. Like maybe it's in 2 days, maybe it's in a week, maybe it's 2 weeks. Not schedule some heavy operations for the dates when he is going to quit, because then he's not going to make it. I think it would be the best if you know, like went away on a vacation or took a couple of days off and went someplace. And is there any chance of you cutting down and working less hours?
Absolutely.
I mean, for the rest of your life.
Yes.
Because what's the use of you working that many hours? At your age, you should enjoy more of life and less of these operations.
She will tell you I've already taken steps to do.
Yes, he tells me this every 5 years. Here you brought up a very sore subject.
Well, then that's one point on your side.
And how long has it been since you had a cigarette?
9 days.
That's wonderful. Very good. That's very, very good. You are the very first graduate of our program. That's wonderful. All right, I'll pin this on right over here.
I think one of the things about cigarette smoking that you have to recognize is that it's perfectly normal behavior engaged in by perfectly nice, normal people, most of whom started the habit long before they knew that it was seriously harmful.
Why do you want to stop smoking?
It's bad for my health.
Do you really believe that?
Oh, yes.
It was a minor risk. It was one of the things that they got some satisfaction out of, and although they suspected that it wasn't particularly good for them physically, they certainly had no idea that it was seriously harmful. Now all this has changed. It's turned out that it is seriously harmful, and yet many people are hooked on the habit. They find that they get something from it that's important to them, and it's not easy to change.
Do you find that getting together as a group like we're doing now helps quite a bit?
I would have given up long ago.
Now, are you having any particular problems?
Yes, I like to smoke.
Okay? What do you think your quota should be?
These